A very good day everyone. My name is Vaseetha Ravichandran, a postgraduate student of Master of Science in Applied Physics at University of Malaya. Would like to present my assignment for the course SQA7027 Applied Plasma. Today I'm going to be talking about plasma technology in medical science. So without further ado, let's get started. Before I go further on the topic, let me briefly explain the objectives of my assignment. First objective is to explain the mechanism of plasma technology used in medical science. Next, to discuss how the plasma technology is used to solve issues in medical science. As an introductory explanation, plasma medicine is an emerging field that combines plasma physics, life sciences, and clinical medicine. Plasma medicine is being studied in three categories, which are in disinfection, healing, and cancer, where most of the research are in vitro and in animal models. The plasma sources used for plasma medicine are generally low-temperature plasmas, and they generate ions, chemically reactive atoms and molecules, and also UV photons. According to Friedman and Friedman, they stated that plasma's thermal properties were primarily used in some of the first medical applications. In order to remove tissue, sterilize and cauterize wounds, heat and high temperatures have long been used in medicine. For example, since the beginning of time, warriors have used hot metal objects to successfully treat wounds. However, when tissue comes into touch with the metal surface of a cautery tool, the burnt tissue frequently sticks to the metal. Hence, the burnt tissue may peel away once the metal is later removed, which may cause the bleeding to resume. What differentiates more recent research on applications of plasma in medicine is the exploitation of non-thermal effects. So, why are non-thermal effects of plasma so interesting and promising? In the mid-1990s, experiments were conducted that showed that non-thermal low-temperature atmospheric pressure plasmas, or also known as LTP, can be used to inactivate bacteria. Based on these results, the Physics and Electronics Directorate of the U.S. Air Force Office of Scientific Research, or also known as AFOSR, funded a proof of principle research program in 1997 and supported such research for a number of years. The results from this research program were widely disseminated in the literature, including in peer-reviewed journals and conference proceedings, therefore attracting the attention of the plasma physics community to new and emerging applications of low-temperature plasma in biology and medicine. The goals of the AFOSR program were to apply low-temperature plasmas to treat wounds of injured soldiers and to sterilize or disinfect both biotic and abiotic surfaces. The next part of my presentation will be on the literature review about plasma technology in medical science. According to Tanaka et al., in plasma, reactive species including electrons, ions, and neutral molecules interact alongside excited atoms and molecules as well as ionic and radical species. Any wavelength of electromagnetic radiation can be produced, but the ultraviolet and visible spectrums are the most common. Many chemical reactions can take place effectively in this complicated environment even at very low temperatures. Besides that, Von et al. Stated that reactive oxygen or nitrogen species are a vital part of atmospheric pressure plasmas. Ozone will be a key long-living component of oxygen chemistry in cold plasma at tissue-tolerable temperatures. Similarly, Graves also stated that the rare gas plasma jet is one of the most often utilized configurations for producing cold atmospheric plasma, or also known as CAP, for biological applications. They typically consist of jets of helium and occasionally argon, either pure or diluted with 1% molecular gas such as oxygen or nitrogen. In addition, Schlegel has demonstrated that in vitro that CAP at low concentrations can inhibit the growth of tumor cells and at greater concentration can cause cell death, making it more effective than some conventional therapies like radiation and chemotherapy. Additionally, preliminary findings showed that CAP appeared to be selective towards cancer cells since it was more efficient in tumor cells compared to healthy non-neoplastic cells. Other than that, Weltman and Vaughan stated that the biological effects of CAP are based on two main fundamental concepts according to the current level of knowledge. First, plasma-induced alterations to the liquid environment of cells are a primary cause of the biological plasma effects. Second, most of plasma-induced biological reactions are mediated by reactive oxygen and nitrogen species which are produced in or transported into liquid phases. Based on the figure, it can be said that plasma is a sort of a combination of, first, radicals and chemical products, UV radiation, visible light, electromagnetic fields, thermal radiation, and also electrons and ions that can modify the function of the cells. Cold atmospheric plasma therapy is a new and latest approach whose arrival has astonished experts all around the world from the area of biological and pharmaceutical sciences. Owing to its simple and non-invasive nature, this technique has been admired and encouraged to use different therapeutic regimens like wound healing, ulceration, and cancer. First application is wound healing. A wound is defined as an interruption caused by the normal function and anatomical features of the skin. It is characterized by loss of structural integrity of the epithelial layer and the possible reasons for its thermal and physical abrasion of the skin. The possibility of damage to connective tissues may or may not be observed in the case of a wound. In the case of wounds, plasma is found to be effective due to its potential to induce tissue regeneration and render inactivation of microbial species. The vital element of the plasma formed is the reactive oxygen and nitrogen species. ROS, also known as reactive oxygen, strikes the outer capsule of bacteria and exposes its cell membrane. The ROS is composed of radicals like oxygen, hydroxide, peroxide radical, and atomic oxygen. The availability of oxygen to cells in the wound area and the presence of adequate blood flow are important factors to the healing process. ROS and NO mediate the formation of growth factors, and these factors are essential for regulating reepithelialization and wound contraction. Besides that, plasma technology is also used in cancer treatment. Cold physical plasma, a partially ionized gas, is a new modality in cancer research. Physical plasma produces various physicochemical factors, primarily reactive oxygen and nitrogen species, causing cancer cell death when supplied at supraphysiological concentration. It was demonstrated that CAP selectively targets the cancer cell cycle. This increases the oxidative stress on cells, which may explain the selective killing of cancer cells which are already oxidatively stressed. Similar to chemotherapy and radiotherapy, CAP selectivity is ensured by interfering with the mitotic cell cycle and inducing cell cycle arrest, DNA damage, and apoptosis via ATM expression and phosphorylation of p53. Lastly is root canal disinfection. Liu et al. Used a reliable and easy-to-use plasma jet device that could generate plasma inside the root canal. The plasma helps to remove large bulk of the pulp tissue and necrotic debris and bacterial biofilms. Reactive oxygen and nitrogens destroy the bacteria exist in the root canal. Preliminary inactivation study results showed plasma produced can completely kill Enterococcus faecalis, which is one of the main bacteria responsible for failure of root canal treatment within few minutes. The advantage is that the plasma could be touched by bare hands and directed manually by a user to place it into root canal for disinfection without causing any painful sensation. That is why plasma technology in dental application also should be further investigated in deepened manner to ease the patients as well as the doctors for surgery purpose. In a nutshell, medical plasma technology has ever been evolving since its first introduction. The effects of plasma treatment are under active investigation across the globe. Plasma is being tried on numerous types of cells, tissues, and diseases in order to identify its clinical indications due to its advantages, which are low temperature treatment, environmentally friendly, and also short treatment time. At present, elucidation of the exact effects of plasma on living cells at molecular level is warranted. The optimal treatment parameters for each medical use ought to be determined, as plasma treatment tends to show a biphasic effect. Moreover, clinical studies carefully designed to validate the safety and efficacy of medical plasma seem mandatory so that plasma can truly be incorporated as a therapeutic option. Although plasma technology is on the verge of a new era, the importance of the confirmation of its biological safety cannot be overstated. With that, I would like to end my presentation. Thank you so much for listening.